So after talking with you and after reviewing your chart, I see that you're 22 years old and you're transferring care here for your annual exam. I see that you had your first PAP with a previous provider 1 year ago, and that PAP was abnormal and showing a mild change called LSIL, or low-grade squamous intraepithelial lesion, and it also showed that you were positive for HPV. Did they explain this to you at your last visit? Good. So when we see these changes and we have a positive result for HPV, we know that the HPV is likely causing these cellular changes. And so we offer testing per the recommendation of the ASCP to keep an eye on it. The ASCP is an organization that kind of gathers all the current research, and they formulate these screening recommendations to help us know how to care for patients and help to reduce the risk of cancer. So that's kind of where the guidelines come from, and it depends on your age and other risk factors. So let's talk about HPV. It's a virus that is transmitted by vaginal, anal, or oral sexual contact, and it has a lot of strains, and it's pretty common. Actually, it's estimated that 80% of the population has even been exposed to it. So this HPV virus can be eliminated by our body's own immune system, or in some cases it can lead to cancer and genital warts. So kind of a wide spectrum of what these strains of the virus can do. And so because of the cancer and genital wart risk, that's why we monitor it closely. So due to your history of abnormal PAP, the current recommendation for you, according to your age and that history, is to have a PAP smear again today to see if there are any further changes. So if your PAP smear is normal, showing the same LSIL again, or shows a change to abnormal squamous cells of undetermined significance, which is also known as ASCUS, then we will still proceed as we did with the last PAP and do another PAP at your next visit in 1 year. However, if there are more significant changes, then we may need to discuss doing what is called a colposcopy. So this is a magnifying instrument that we use to closely examine the cervix, vagina, and vulva. It's kind of similar to how a microscope works, but it's an internal exam with a small scope instrument. So what this does is it would allow us to see what kind of changes are occurring a little more accurately, just so we could kind of get a better idea of what's going on and what sort of changes we're seeing. So if you're okay with having the PAP smear today, in addition to your annual exam, I will explain that as we go each step along the way. And then when we have the results from this PAP, then we'll kind of go from there to determine the plan of care and what comes next. So let's talk about prevention. Are you using birth control? Are you using condoms in addition to this birth control? Even though you already have the HPV virus, there are many other strains that you can still acquire, including those serious strains that can lead to cancer. So it is so important for us to use protection, such as condoms, to reduce this risk. Men and women can pass HPV without knowing that they have it. In fact, most of the time people don't know they have it at all, which is why this is so widespread. And you're also still able to get the HPV vaccine if you would like it, so that's something we can discuss as well. This will not cure the HPV that you have now, but it can protect you from getting some other strains, if that makes sense. What questions or concerns do you have?